Hi, this is Ravi Dahiya. I just wanted to kind of touch on a topic that's been a hot topic, I guess, for lack of a better term. I did a video recently on how to fix bad fillers. We were getting a lot of responses to that, and I think it's a function of the fact that there's just a lot of people getting these treatments done with fillers. Unfortunately, what it's revealed to me is what I suspected, which is that a lot of people have providers that are really just focused on using certain fillers, namely the HA fillers, and there's nothing wrong with those fillers in general. But when there's just an over-reliance on one type of filler kind of for all purposes in the face, that's where there's a problem. Each part of the face, each skin type should be treated differently. So I would just urge you to make sure that your provider is well versed in all the different filler options, so you're not sort of stuck with just one treatment plan. Because as rewarding as it is to kind of help someone fix an issue if they've had a problem, I'd much rather for you as a patient not to have the problem to begin with and just have a good outcome from the start, because it's tough to go through kind of a process where you have to fix something that didn't go quite right the first time. So hopefully you'll find the content information, or rather the information helpful, and we'll have more updates and more in-depth discussions about the topic. So thanks for joining me today, and look forward to talking to you again about it.